Hello, my name is Alan Simpson and I'm a student at the University of North Dakota studying occupational therapy. And today I'm going to talk a little bit about how you can relieve neck pain. And it's typical, we know that you can rub down the traps and you can work on the neck directly, but it's possible that those aren't really relieving your symptoms that you have. So today I'm going to talk about how you can treat the Pectoralis Minor and how that might help alleviate some of the symptoms that you may be having in your neck. And so this is Jacob. A little bit about Jacob. He was in a car accident that leaves him with some chronic pain and some chronic headaches, and it has really limited the occupations that he enjoys to do. He hurts constantly if he wants to do any volleyball. He hurts after he comes home from work. The headaches are affecting his schoolwork. And so this is a thing that the doctor recommended we do to help alleviate some of those symptoms. And for Jacob, the pectoralis minor is so tight that it's beginning to compress all the other muscles and to put them on stretch and to really pull him in. And so we're going to work on the pectoralis minor in hopes that we can soften that muscle up and so that the other muscles will relax as well. And so to begin, I'm going to talk a little bit how you can palpate the muscle. The pectoralis minor is located under the pectoralis major, and so to get to it you really have to go under the major and then up into the minor. And when you get up into the minor, you're going to want to hold it for about 30 seconds or so. And it's not going to be the most fun for them, especially for Jacob as he's really tight. So you're going to apply some steady pressure on that trigger point, and you'll be able to feel the muscle begin to relax a little bit, and that's when you want to go just a little bit further in. You want to do for about 30 seconds or so, and then normally you would do it multiple times, but for today we'll just leave it at that. So that's one thing you can do, and that kind of helps open things up. And the next thing you can do is you can use Kinesio tape. So I've got some of that here. And Kinesio tape, it's a really good thing that works really well on muscles. The science behind it is that the body possesses a natural ability to heal itself. And so the Kinesio tape has about 130 to 140% more stretch than your regular athletic tape. And so it allows the body to move, but it also does many other things like opens up the lymphatic system to flow better. It kind of reminds the brain that this muscle is here and that it's tight, and so that the body triggers itself to begin the healing process. Other things that you'll see it do is that it can correct joint problems. If a muscle is too tight, it can help alleviate that. If you have any type of swelling as well, Kinesio tape works really well for that as well. So, for the pectoralis minor, since it is located under the major, we tape right across here and then down to here. So, let me go grab some scissors real quick. Some things to keep in mind when you are kinesio taping: you want to round the edges, and that's going to help your stick of the tape. For this particular tape job, we're going to need it in a Y shape. So when doing that, you're going to leave the base a little bit thicker than the actual pieces. So the base of this Y is going to go at the base of the coracoid process, right there. And once you have that on, you're going to want to bring the patient into abduction, or the body away from the arm, and then you're going to have them go into external rotation. And Jacob doesn't have a lot of external rotation because he is so tight. But if you're explaining it to a patient, just tell them, go back like you're throwing a baseball or you're about to spike a volleyball. And that's where you want to put them on to stretch out that muscle. Then the first piece should follow the superior border of the pectoralis minor to about the third sternocostal. And when you put it on, you really want to rub it, because it adds some adhesion to the stickiness of the tape, and it's going to help you stick longer. The second one is going to go to about the base of the fifth sternocostal, and it's going to follow along the base of that muscle. Okay, you can put your arm down now, Jacob. And so it's natural to have a little bit of wrinkles in it like that, and it's also good for the muscle and for the skin. And so the purpose of this is to help loosen up that muscle, help the lymphatic flow, as well as that's probably causing some of the adhesion that he has. But mainly we want to get him back to functioning and doing his occupations with the least amount of pain as we can. So we want him to be able to go play volleyball with his friends or basketball with his friends and not be hurting the whole step of the way. And if I were to do a full treatment on him, I would also do a tape from about his C3, C4 vertebrae up to both sides of his collarbone, and that helps remind the neck and the trapezius muscles to pull back, and that helps his posture. And I would also do some deep pressure neck rub, as well as finding trigger points in the neck to help with that. But for today, I hope this video helps with addressing the pectoralis minor, and I really do encourage you to try it out if the other things haven't been alleviating your pain.